This is Dr. Lisa Snelling. Patient's name is Jessica Black. Date of birth 8/13/72. She visited the clinic was June the 8th, 2013. Today's date is July the 3rd, 2013. Jessica Black is a 40-year-old woman who presents with a 3-month history of increasing fatigue, period. She first noticed that she felt tired when she was working long hours to get a job done at work, but has been working her usual 8 hours a day for the past 2 months and has not regained her energy, period. She describes her fatigue as, begin quotation, feeling limp, end quotation, period. Her fatigue is present throughout the day, but is worse with significant exertion, such as walking more than 3 to 4 blocks or going up a more than one flight of stairs, period. She has tried to go to bed earlier, but even sleeping up to 10 hours per night, in parentheses, she usually gets 8 hours per night, in parentheses, has not resulted in less fatigue, period. She is concerned that there is something seriously wrong, as she is usually quite full of energy, and her family and friends are starting to ask her if she is sick, period. She also has not been able to exercise, which she usually enjoys, period. New paragraph. She does not report any chest pain, shortness of breath, abdominal pain, nausea, vomiting, or diarrhea, or any change in her stools, period. She has no alopecia or skin changes, period. She has had no fever, chills, or night sweats, period. She has gained about 6 to 7 pounds in the last few months, she assumes from inactivity due to her fatigue, period. She does not feel depressed, mood, sadness, or anhedonia, which is anhedonia, period. She states that she goes to bed at 10 p.m. and wakes up feeling tired at 6 a.m. on weekdays and 8 a.m. on the weekends, period. Her husband states that she has, begin quotation, always, end quotation, snored quite loudly, period. Her menses are regular in timing, heavy flow for 1 to 2 days, then lighter for another 2 to 3 days, period. This pattern is unchanging from prior to the onset of her fatigue, period. Her last menstrual period was 1 week ago. Begin new paragraph. She has a history of GERD and depression, period. Her medications include ranitidine, 150 milligrams by mouth at bedtime, sertraline, sertraline, 100 milligrams daily, calcium, 600 milligrams BID. Objective. Generally, Jessica appears well in no acute distress, period. Next line. Temperature 97.9, pulse 80 and regular, respiration rate 12, blood pressure 140/86, height 67 inches, weight 195 pounds, BMI 30. Next line. Skin, not pale, no rashes. Next line. Neck, no thyroidomegaly or thyroid nodules, period. Next line. Nodes, no cervical, axillary or inguinal lymphadenopathy, period. Next line. Chest, clear to auscultation and percussion bilaterally. CV, and this is the next line. Rhythm and rate are regular. +2/6 systolic ejection murmur. Heart best at the LLSB and radiates to the apex, period. No S3 or S4, period. New line. ABD, normal active bowel sounds, no hepatosplenomegaly by palpation or percussion, no abdominal tenderness. Next line. EXT, no edema, 2+ posterior tibialis and dorsalis pedis. Assessment. Recent onset of fatigue, with no obvious inciting event, period. Hypothyroidism is possible, especially given her weight gain, though this also may have occurred from her inactivity, period. It is possible that she is anemic, though her menstrual periods have not lengthened or increased, and there is no other obvious source of blood loss, period. A recent menses makes pregnancy unlikely, period. Given her history of snoring and hypertension, sleep apnea is possible, but her history of snoring over many years is not entirely consistent with her more recent onset of fatigue, period. Her use of HCTZ does put her at higher risk of hypokalemia, which, if severe, could contribute to fatigue, period. She does not seem to have recurrence of her depression since she has no new symptoms, period. She does not have symptoms of infection, nor has her murmur changed, so subacute bacterial endocarditis is possible but unlikely, period. The plan. Number 1, check a TSH to rule out hypothyroidism, period. Next line. Number 2, check CBC to rule out anemia, period. Next line. Number 3, check K to rule out hypokalemia, period. Next line. Number 4, if the above are unremarkable, consider sleep study to rule out sleep apnea, period. Next line. Number 5, also consider blood cultures to rule out subacute bacterial endocarditis, period. Now, next line. Number 6, follow-up visit in 1 week to discuss test results and further workup, period.